Hello everyone. In this video, we will be seeing cryotherapy. Cryotherapy is the treatment of pathological lesions by the use of low temperature agents such as ice, frozen gel packs, and vapor coolant spray. Physiological effect of cold. Hemodynamic effects. There is vasoconstriction followed by vasodilatation. Vasoconstriction persists if the duration of cold application is limited to less than 15 to 20 minutes. After that, there will be vasodilatation. This is Lewis-Hunting response. Neuromuscular effect. Reduces nerve conduction velocity, increases pain threshold, decreases spasticity, facilitate muscle contraction. Metabolic effect. Cold reduces metabolic rate. That's why it is selected for acute inflammation, because in acute inflammation there is increase in metabolic rate. Cold is applied in osteoarthritis, rheumatoid arthritis, etc. because enzymes responsible for these diseases such as elastase, protease, hyaluronidase is destroyed by the cold application. Therapeutic effect and uses. Acute inflammation. The duration of the cold application is 15 minutes or less. As there is decrease in inflammation, there is also decrease in pain. Control edema. Cryotherapy is recommended for localized edema because it is due to acute inflammation. It is recommended to apply ice immediately to control bleeding and to produce vasoconstriction, thereby decreasing swelling. Pain control. Cryotherapy can decrease pain by two methods. Direct method by blocking conduction. Indirect method by reducing edema, spasm and inflammation. The duration of cold application is 10 to 15 minutes. Control of pain for 1 or more hours. Reduce spasticity. Cryotherapy is used to reduce spasticity in patient with upper motor neuron lesion. Application of cold for more than 30 minutes reduces muscle temperature and thus reduces nerve conduction velocity, causing inhibition of the contraction of spastic muscle, causing a reduction of spasticity. This spastic muscle remain relaxed for 1 hour or more. Facilitation of muscle contraction. Quick icing is used to facilitate muscle contraction. Symptoms management in multiple sclerosis. Symptoms get aggravated in hot climate. To decrease the symptoms, a generalized cooling is found to be effective. Method of application of cryotherapy. Cold pack or ice pack. It can be either homemade by clinician and commercial. Homemade. Ice is wrapped in a polythene and then with towel. Commercial. It consists of a gel made up of silica and gelatin which is covered by vinyl covering. The temperature of cold pack is minus 15 degrees Celsius. Initially, the cold pack is stored in a freezer for 2 hours and allowing it to be cooled for 30 minutes between uses. Before applying ice pack, vegetable oil or nut oil is applied to prevent ice burn. The towel is wrapped around ice pack and then applied and secured with elastic bandage or straps. Ice pack is applied for 10 to 15 minutes to control pain, edema and inflammation. For spasticity, ice pack is applied for 30 minutes. Ice massage. In that, ice blocks are used. The ice massage is applied in form of small overlapping circles. It is used to facilitate muscle contraction and to treat pressure soreness. For pressure soreness, ice is applied on sore for about 2 minutes followed by drying of skin and then reapplied for total 3 to 4 times. After the treatment is over, the same procedure is followed as in ice pack application. Ice towel. It gives cooling superficially and suitable for large treatment area. It has bucket and 2 parts of crushed ice and 1 part of water. Towel is dipped in the bucket and wringing to remove excess of water. The towel is placed to the treatment area. The treatment is given for about 20 minutes. Immersion. The part to be treated is immersed in the ice solution. This treatment is suitable for distal parts such as hand and feet. For this, 50% of ice and 50% of water is taken in a container. The part to be treated is immersed for 10 minutes or series of short immersion are made for 10 minutes. Vapor coolant spray. It consists of volatile substances such as ethyl chloride or fluoromethane, etc. This is applied directly over the area to be treated. It is applied in a number of short bursts, 5 seconds each for 3 to 5 minutes. This type of treatment is applied in a sports injury. The combination of spraying followed by stretch is called a spray and stretch technique. The spray is applied from the distance of 45 cm from the skin and at an angle of about 30 degrees. Technique of application. Check for the contraindication. Check for the sensation impairment with hot and cold. Explain the procedure to the patient according to the method selected. The part to be treated should be exposed and removed from the jewelry. Before applying cold, check for the burning, aching, analgesia and numbness. Now apply cold to the patient. At the end of the treatment, check the patient has achieved desired goals and check for any adverse effects. Contraindication: peripheral vascular disease. In diseases such as atherosclerosis, there is already vasoconstriction and application of cold will further lead to vasoconstriction. Vasospastic disorders. Vasospastic disorders such as Raynaud's disease, which is associated with excessive vasospasm, should not be treated with cryotherapy as the same may further induce vasoconstriction. There may be impaired circulation. Cold urticaria. In patients with cold urticaria, the condition may get aggravated due to release of histamine from mast cells, causing local wheal formation, itching and development of erythema. Cryoglobulinemia. The application of cold may lead to precipitation of abnormal blood proteins, which may block blood vessels, causing complications. Over regenerating peripheral nerves. Cryotherapy should not be applied directly over the regenerating peripheral nerve as local vasoconstriction affect the nerve regeneration. Precautions. Open wound. Cryotherapy should not be applied directly over a deep open wound as it may delay the healing by impairing circulation and metabolic rate. Hypertensive patient. As cold can cause the transient increase in systolic and diastolic blood pressure, patients with hypertension should be carefully monitored during the application of cryotherapy. Treatment should be discontinued if the blood pressure increases beyond safe level. Cardiac disease. Cryotherapy should not be applied over the left shoulder as it may inhibit cardiac function in the cardiac patients. Defective skin sensation. Cryotherapy may be hazardous. Skin hypersensitivity. In patients with cold intolerance in form of numbness, pain or color change, cryotherapy should not be applied. Adverse psychological factors. Some patients react adversely when cold is applied. So in such patient, cryotherapy should not be applied.